How would you like to reduce or eliminate your reliance on agency staff and be fully staffed with permanent local staff? I just recently spoke with a small rural nursing facility who's operating fully staffed by agency staff with 6 nurses and 5 aides. The current bill rate for a 13-week RN assignment costs a long-term care facility up to $50,000, averaging out at about $125,000 a year per nurse. So instead of continuing to lose revenue to staffing agencies, you can save up to $500,000 in 6 months with my Stabilize Your Staffing SOS program for nursing facilities, while improving your survey outcomes and quality measures. The Centers for Medicare and Medicaid released a report in January disclosing facilities that had immediate jeopardies and fines during COVID. They were careful to point out those facilities had low staffing that contributed to over half of them having those negative survey outcomes. And while COVID has certainly contributed to the struggle to maintain adequate staffing levels, many skilled nursing facilities operated in a staffing crisis as their baseline prior to the pandemic. As a successful long-term care organization, you've seen the effects of critical staffing on your facilities and their leaders. Increased deficiencies, state reportables, leadership turnover, civil money penalties, and lost revenue, not to mention decreased census, patient satisfaction, and quality measures, all related to low staffing levels. I'm Nina Hart, and as a nurse leader who's spent over a decade in long-term care management and as a former director of nursing myself, until I reached the corporate multi-site operation level, I didn't understand how labor costs impact the health of the entire organization. It's something as clinicians we're often not trained on. My SOS program teaches long-term care clinical directors how to take control of their staffing and take ownership of their facilities' clinical staffing operations. Most of the DONs that I speak with are overwhelmed by constant staffing issues and exhausted from being pulled to the floor. They spend hours finding coverage for the floor and just trying to get the patients taken care of, leaving survey prep as an afterthought. The results of constantly patching staffing holes are negative patient and survey outcomes. My 90-day SOS program empowers your directors to be able to quickly stabilize critical facility staffing levels. This 13-week consulting package provides tools to assess the current staffing needs, eliminate reliance on agency, address issues within the current team to maximize operational efficiency, and become laser-focused on getting fully staffed and staying that way. They'll receive 8 power hours of training and support targeted toward creating staffing systems that work for the facility and the organization, as well as tools and resources to support successful implementation. Stabilize Our Staffing SOS program can help your organization see increased profit margins and the ability to capture back your revenue, improve survey and clinical outcomes, along with an improved facility reputation in the community. Decreased turnover and consistent staff have been shown to reduce medication errors, falls with injury, weight loss, infection, and wounds, among many other undesired complications and negative outcomes for patients. This program will help your facility clinical leaders identify staffing areas that require immediate attention, put an action plan in place, and execute it. The structure of the program provides support to address barriers and creates built-in accountability by providing reporting on the facility's progress towards the desired outcomes. So if you'd like to learn about how SOS can help your facilities become self-reliant with their staffing, gain back control over your revenue and corporate resources, reach out today and stabilize your staffing with SOS.